I'm Joe Graedon.
And I'm Terry Graedon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Shakespeare's credited with the phrase, "The eyes are the window to the soul." Are they also the window to the brain? This is the People's Pharmacy with Terry and Joe Graedon.
Our guest in the studio today is a retinal specialist. She studies how the retina reveals what's happening in the brain.
She'll also answer your questions about eye health. Are you concerned about the epidemic of myopia in children? What about macular degeneration or glaucoma?
Dry eyes are common, but there's been controversy about the safety of some over-the-counter generic eye drops.
Coming up on the People's Pharmacy, we'll take your calls about how to keep your eyes healthy.
In the People's Pharmacy Health Headlines, the FDA has just approved the first novel drug treatment for schizophrenia in decades. Cobenfy, also known as CAR-XT, is a combination of two medications, xanomeline and trospium. What makes this drug different is its mechanism of action. Unlike conventional antipsychotic medications like chlorpromazine or olanzapine, Cobenfy works through receptors for the neurotransmitter acetylcholine. This means it's less likely to cause the most troublesome side effects of previous drugs. They work directly through an effect on dopamine. Many people find these older medicines difficult to tolerate because they can cause movement disorders, irregular heart rhythms, brain fog, diabetes, high cholesterol, or weight gain. The new antipsychotic medication has some adverse effects: heartburn, nausea, vomiting, stomach pain, high blood pressure, dizziness, and urinary retention. Cobenfy is likely to be pricey, more than $20,000 a year. Long-term effectiveness is yet to be determined.
Medication use by older Americans has increased over the years. The latest statistics from the CDC reveals that roughly 90% of respondents over 65 had taken a prescription medicine in the past year. About 4% needed prescription medications that they didn't take because they couldn't afford them. Out-of-pocket expenses for drugstore medications topped $63 billion. Almost half of the older adults reported a diagnosis of arthritis. 20% had been diagnosed with diabetes, 48% with high cholesterol, and almost 60% were hypertensive. A quarter of those surveyed reported that they had difficulty paying for their prescription medications.
Many people who've had COVID-19 complain of brain fog following the infection. New research published in Nature Medicine confirms that the infection can lead to cognitive impairment up to a year later. Not all people hospitalized with severe COVID ended up with neurological complications, but those who did responded to cognitive tests as if they were 20 years older than their chronological age. They also had high levels of proteins indicating brain injury. MRI showed that some areas of the brain had shrunk. The researchers point out that COVID-19 is not just a lung infection. Some of the most severely affected patients have brain complications that can be persistent.
Researchers at the University of Texas have published research on brain fog following COVID-19 infection. They report that a brain imaging study showed a reduction in connectivity between regions of the brain. These disruptions in normal connections between the cortex and lower brain structures are associated with less efficient brain function. This was also associated with subjective reports of brain fog and fatigue. The researchers concluded that even mild to moderate cases of COVID-19 can alter patterns of information processing and effective information flow.
Eye doctors have been concerned for some time that rates of nearsightedness, also called myopia, have been increasing, especially in children. A new analysis of 276 studies covering more than 5 million children and adolescents has shown that myopia has risen from 24% in 1990 to 36% in 2023. The investigators found that the increase was especially dramatic after the COVID-19 pandemic. The prevalence of myopia is highest among East Asian children who tend to start their formal education at age 2 or 3. Younger children seem to be more vulnerable to environmental factors. Previous research indicated that kids who spend more time outdoors playing are less likely to develop the eye shape that leads to nearsightedness. The scientists project that by 2050, over 700 million children and teens worldwide could suffer from myopia. Cell phones, tablets, and other electronic devices have become so integrated into daily life that reversing the trend is now impossible. If schools and parents would encourage more playtime outside, it's possible that the pandemic of myopia could be stabilized. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graedon. I'm a medical anthropologist.
And I'm Joe Graedon. I'm a pharmacologist. Today, we'll be discussing how you can protect your precious eyesight. We invite you to join the conversation. 888-472-3366 is the number. You can email us your questions about how to keep your eyes healthy. It's radio@peoplespharmacy.com.
Here in the studio, we have Dr. Sharon Fackrat. She is a retina specialist at the Duke Eye Center and vice chair of faculty affairs, as well as professor of ophthalmology and neurology at Duke University School of Medicine. She's associate chief of staff at the Durham VA Healthcare System, and past interim chief of surgery there. She's currently director of the Duke iMind Research Group and chief editor of the book All About Your Eyes. Welcome back to the People's Pharmacy, Dr. Sharon Fackrat.
Thank you so much. I'm excited to be here today.
And we're thrilled to have you. Dr. Fackrat, we're going to talk about your iMind research in a moment, about how your retinal scans are revealing insights into Alzheimer's disease and other neurodegenerative diseases. But first, that last news story that we were talking about, a story that's been in the news this week about children's eyesight. It was a meta-analysis. It was published in the British Journal of Ophthalmology, and it reported that myopia, and we're going to ask you what that is, in children has gone from 24% in the 1990s to 36% in 2023. And younger children seem to be especially vulnerable. So, number one, what is myopia or nearsightedness, and why is it increasing at such a great rate?
Myopia is nearsightedness, and what that means is that without glasses, you can only see clearly at near or up close, and that you require glasses to see far away. During the pandemic, as many of us know, we spent most of our time indoors, and to keep young children busy too, they spent a lot of time doing things at near, very, very close to them. And so their eyes didn't get a chance to develop to be able to see far away.
And I'm wondering about screens, because it seems like everybody is on their cell phone, their tablet, their computer. But young children, especially in countries like China and Japan, they're starting school very early. And therefore, they may be spending even more time reading.
Yes, so it's not the screen itself, but it's the fact that they're doing constant near work at a very, very young age. And that is contributing to the development and the marked increase or the pandemic of myopia.
Well, I'm wondering about, the implications, because I was diagnosed with myopia at a relatively young age. I was in 5th grade. I was so delighted to have glasses because it meant I could see stuff.
But your daddy said,
Oh, Well, my dad, he didn't say it when I was in the 5th grade. He started saying it later. He would say, "Men don't make passes, they're girls that wear glasses." And then he would insist that I had to wear my glasses to the dance, which was not at all a good
Mm.
match.
Well,
How
parents try their best.
However, my dad was very nearsighted as well, and I'm sure that's probably why I developed myopia. The question is, so I've been wearing glasses my entire life, basically. Oh, what's the big deal? Is there a problem with myopia beyond just wearing glasses?
especially in young kids.
Yeah, so we categorize myopia, as mild, moderate, or severe. And so with myopia, especially when it starts at a very young age, it progresses, the eyeball itself elongates. This process sort of stops around the age of 20, but with a very long eyeball, the white or sclera of the eye elongates, but the retinal wallpaper inside doesn't. And so you can get stretch marks, so to speak, and complications of that. You definitely don't want a stretch mark right through your central vision of the retina. And then sometimes abnormal blood vessels grow through those and cause bleeding and scarring and decreased central vision.
So, is there any way to prevent nearsightedness?
We have learned a lot about myopia and how to maybe decrease the progression of myopia. And this is new information for us. And so the recommendations now are, especially in young children between the ages of 7 and 9, after 20 minutes of near work, look up at 20 feet away for 20 seconds and spend more time outside, which encourages distance viewing.
It seems to me that we've been hearing the recommendation of every 20 minutes or so to look away from your screen for 20 seconds
Yes,
for adults for quite a while. So now we're saying, well, we need to be paying attention to the kids too.
exactly.
Well, if you have a question for our guest, one of the country's leading experts in retina issues, but also a very wise ophthalmologist, you can join our conversation. The number is 888 472 3366. When our lines get full, which we suspect they will very quickly, you can email us radio@peoplespharmacy.com. If you have a question about glaucoma, cataracts, nearsightedness, whatever is on your mind. We're talking about your precious eyesight today on the People's Pharmacy. Again, our phone number 888 472 3366.
And one of the questions that we got today was about contacts versus eyeglasses. The question is, the questioner has both and uses them, I guess, somewhat interchangeably. Is there one that's better for the eyes?
When we're thinking about contact lenses and glasses, it's a very individualized decision. Glasses are easy. You pick them up, put them on. They provide physical protection of your eyes. Contact lenses, especially in individuals that are very nearsighted, may offer a better quality of vision. You do, though, with contact lens wear, have to be very meticulous. Wash your hands. Be careful inserting them and taking them out, and definitely do not sleep with them on.
Why?
Sleeping with contact lenses on, studies have shown that there's an increased risk of complications, particularly infection of our always clear cornea that covers the pupil of our eye.
I have a question from Jim, and it's kind of unusual. We don't often get questions like this, but Jim says, how can I protect my eyesight around arc welding equipment? I work as a technician, not as a welder. As a result, I don't use a dark shielded lens to protect my eyes. I don't look directly at the arc. However, I'm constantly walking around them. Are there any special protective safety glasses that have UV blocking specifically for arc welding?
That's a fabulous question. And so it is the act of looking at the welding that can cause the damage. And so it's very important to wear eye protection. And yes, there are specific glasses for protecting your eyes during those activities. And so I suspect the employer requires that to be worn.
Dr. Fekrat, Donna has a question here. She says, I was diagnosed by one eye doctor over a year ago with high eye pressure. He put me on latanoprost eye drops, and my eye pressure is around 15, which is where it stays. When I went to another eye doctor for cataract surgery, he referred to my problem as glaucoma. This sounds a lot scarier than high eye pressure. Did my condition change, or is it just a different name for the same condition?
That's a wonderful question, Donna. So, uh, glaucoma is a diagnosis that is made when there is usually high pressure, although there can be normal pressure glaucoma. But usually, glaucoma is high eye pressure, and we make that actual diagnosis when we see damage from the pressure. However, if we just see somebody with high eye pressure and no damage, we may be a splitter versus a lumper, and we may say it's just high eye pressure. Let's lower it with an eye drop like latanoprost to prevent damage.
Now, what is this idea of low pressure glaucoma? That's something that most people are not aware of.
So, low pressure glaucoma is something that is uncommon, but that we see progressive damage in the eye, particularly to the optic nerve, which is where glaucoma damage happens. But the eye pressure is always normal when we measure it in the office. And normal eye pressure is between 9 and 21 millimeters of mercury. Now, I will note that the eye pressure varies throughout the day, like your mood or your blood pressure, and it's possible that it's high at night but low during the day. So we're still trying to understand that better.
Joe, do we have time to talk to Nan in Tampa?
I think we have a break coming up, so let's hold Nan. But I
Okay.
do have a quick question for you. Dr. Fekrat, you've done a little research with curcumin after retinal detachment. Tell us how that went.
Uh, so curcumin, is related to turmeric, which is a yellow spice. And many doctors throughout healthcare now and other providers are suggesting curcumin and turmeric for its anti-inflammatory properties. So, a special brand of curcumin is known to cross the blood-retinal barrier and have very good absorption through the bowels, and it may inhibit scar tissue that can lead to retinal redetachment.
So there's a reason to believe that it might work, and you don't have results yet.
We think it may work, and yes, we have a recent paper that was published.
Okay, we'll ask you about that after the break. When we come back, Dr. Fekrat will answer your questions about common eye problems like macular degeneration, or if you've got more questions about glaucoma, you're welcome to call us 888-472-3366.
If the lines are full, you can send an email. It's radio@peoplespharmacy.com. That number, 888-472-3366. You're listening to The People's Pharmacy with Joe and Terry Graedon.
This podcast is made possible in part by CocoVia, backed by 20 years of scientific research and the maker of the most proven and concentrated flavanol extract in the market today, Coco Pro Cocoa Extract. Cocoa flavanols are among the most studied plant-based bioactives today and are clinically proven to promote cardiovascular and brain health for the long term, supporting a strong heart and better memory.
Get 15% off your order of any CocoVia product by using the discount code PPOD15. Learn more at CocoVia, and remember that discount code is PPOD15.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Welcome back to the People's Pharmacy. I'm Terry Graedon.
And I'm Joe Graedon. The People's Pharmacy is made possible in part by CocoVia dietary supplements. Cocoflavanol supplements that support cognitive and cardiovascular health, made with proven flavanol extract. More information at cocovia.com.
Today we are discussing how to keep your eyes healthy. Our guest, Dr. Sharon Fekrat, is ready to answer your questions. She's a professor of ophthalmology and neurology at Duke University School of Medicine. She is Associate Chief of Staff at the Durham VA Healthcare System and a retina specialist at the Duke Eye Center. Dr. Fekrat is director of the Duke iMind Research Group and chief editor of the book All About Your Eyes.
Our lines are open for your questions. And in fact, they are all full at the moment, but the number is 888-472-3366. If you can't get through, which you won't be able to for a few minutes, you can email us, radio@peoplespharmacy.com. And we're going to go to Nan, and then we're going to find out about your latest research.
Let's talk to Nan in Tampa. Nan, you're on the People's Pharmacy. Give us your question, please.
Hi. I was diagnosed with macular degeneration. It's fairly mild, apparently. It's dry macular degeneration. I have a very healthy diet. I've been a journalist writing about the environment and health for many years. This is sort of a devastating diagnosis to me. I'm wondering, is there anything that one can do about it? And would I have to have surgery for my knee? And will any of the anesthesia affect my retina? The other thing that I had a quick question is I recently read that melatonin taken on a regular basis in a study, this is a scientific study, they said that it seemed to prevent the dry macular degeneration from proceeding, which is what I have.
And Nan, we're going to ask you to take your answer over the radio.
So, Dr. Fekrat, what's the difference between dry and wet macular degeneration? And then if you can help Nan with her question about the anesthesia and what she should be doing. So give us an insight on what is macular degeneration.
So, macular degeneration is age-related. It's most common in individuals over 65 years old. And we divide it into two broad types, dry and wet. Everyone who develops macular degeneration starts with dry, and I'm glad to hear, Nan, that yours is mild. And 90% of individuals do not lose vision from macular degeneration. If you're in the 10% that progresses, it can progress dry and develop areas of atrophy or thinning and blind spots only in the central vision, or the wet kind where blood vessels leak and bleed. Now, I'm happy to say that the anesthesia from your knee surgery will not affect your macular degeneration, so rest assured. Ways to help prevent it from progressing are to wear sunglasses, not to smoke, to have a very healthy diet, including lots of dark green leafy vegetables. And there are some recommended vitamins following a study called AREDS2 that are available. You can ask your doctor about that. And then there is that recent study about melatonin at night. And we're still learning a lot about it, but it may indeed slow the progression. And I suggest talking to your primary care physician about the use of melatonin for your overall well-being.
Now, we're gonna go to Anne in Dallas because I think we should stick with macular degeneration for a moment, and that's Anne's question. Anne, go ahead. Please ask your question.
Thank you. I do have macular degeneration. I have been taking the AREDS for years because my mother also had macular degeneration. Didn't stop it. Mine is still dry. I also wanted to know about, is there a way to cure it? I have been with homeopathic doctor for a year now, or 2 years now. His first go-around didn't work. We're trying something else now. Am I just, climbing up a tree and going to fall down with nothing? Next part of that is I also have cataracts. And I did have surgery on one. The doctor put in the wrong prescription, but I'm wondering if could that have been because of my macular degeneration and he just couldn't handle it, because I had another doctor that turned me down to change cataracts. And another thing to add to my situation, I was a welder for a hobby. So I wonder if did this have the effect on it, because I'm sure I looked at the welds. I'm 75, and I just don't want to go blind. Thank
Well,
you.
we completely understand. Thank you for the question, Ann. We'll ask you to take your answer over the radio.
Yes, thank you so much, Anne. So, cataracts and macular degeneration are not related to each other, and the welding in the past also did not contribute to your macular degeneration. There are no known homeopathic remedies for macular degeneration at this time. We do recommend the AREDS 2 vitamins, which have been studied extensively from the National Eye Institute. And that has been shown to definitively decrease the risk of the dry macular degeneration progressing to the wet type by 25%. And it also does decrease progression of the more advanced forms of dry macular degeneration. So, regular eye exams and checking the vision in each eye separately to pick up anything that develops early is beneficial in preserving your vision. We have many exciting and good treatments should any other issues develop.
And you say you check each eye separately. What kind of a check does the doctor do?
So, this is something that we would recommend that you do at home. So, you can cover one eye and look out of one eye at a time at the same um, image every day. So, either your horizontal blinds, or sometimes your doctor will give you an Amsler grid. You can print an Amsler grid from the internet, AMSLER, and it comes with instructions. So if you see a new area of distortion or a blind spot, it's important to promptly go in. With both eyes open, you may not notice that you have a problem in one eye, so it's good to cover one and check the other by itself.
Oh, that is important information. We do have an email from Barbara who says, I was diagnosed with age-related macular degeneration 5 years ago. I take 2 preservision supplements. Those are those AREDS 2 supplements each day. Is it okay to take them both at the same time, or should I be taking one in the morning and one in the evening? And I'm wondering about the high zinc levels in these pills. Is there anything I should be doing to check up on whether the zinc is doing any harm?
Those are excellent questions, Barbara. So the Preservision AREDS 2 vitamins can indeed be taken at the same time. Some individuals prefer to take them at separate times because, as you know, they're very large pills. Um, it's actually the zinc in the preparation that is thought to be the most beneficial. And that's the reason the Preservision pills have cupric oxide or copper in them to prevent a copper deficiency anemia that can develop if you take a lot of zinc.
I'd like to go back to your research with curcumin, the active ingredient in turmeric. Did you find any benefit, A? And as soon as we get the answer to that question, I want to find out what's going on with your iMind research and what it is and what you're looking for.
Yes, so the special preparation of curcumin that we use does cross into the eye, and it has been shown to decrease the risk of scar tissue in eyes that have complicated retinal detachments. And yes, we found in our small population that yes, it improved the retinal reattachment rate in individuals who did take curcumin. And that's a really nice segue because the way we discovered it, so to speak, is there is a group in California that uses this preparation of curcumin because it collects in amyloid plaques that are in the retina and in the brain in individuals with Alzheimer's disease.
So, if you see amyloid plaques in the retina, you might suspect there could be some in the brain.
Yes, that's true. You need very special equipment to be able
Hmm.
to visualize the amyloid. Our iMind research is studying exactly that. We are looking at the small blood vessels and the structure of the retina, which is nerve tissue. The retina is an extension of the brain tissue.
And what are you discovering?
We are finding differences in individuals with Alzheimer's disease and Parkinson's and other neurodegenerative diseases. We're looking at multiple sclerosis and ALS, Huntington's, Lewy body dementia, and we're not seeing those changes in or findings in individuals that don't have those conditions. Now, we're particularly using machine learning and AI to try to make a diagnosis more accurately with retinal images.
So I remember many, many years ago, a physician saying, you know, ophthalmologists can see a lot, no pun intended, through the eye. And they can tell things about what's going on in your body, like hypertension or diabetes. So tell us what you're looking for when you look in someone's eye, especially at the retina, and what you can learn about that person's health.
The retina truly is the window to the whole body, not just the brain. So, if you're anemic, for example, we may see splotches of blood in the retina. When you have poorly controlled blood pressure, as you mentioned, we see narrowing of the tiny blood vessels in the retina. They're shiny, they're atherosclerotic. We can see bits of cholesterol that have broken off bigger blood vessels in the body and get lodged in the eye. We can sometimes diagnose leukemia, for example. We can see viral illnesses in the eye, Lyme disease, syphilis, HIV. So there are many things that we can detect with a retinal exam.
So you're talking about infection showing up in the eye, suggesting that these effects can be long lasting. What about COVID?
So we're still trying to really understand what COVID can do to the retina and to the eye. We're looking at inflammatory conditions, changes to the retinal structure, and possibly even retinal vein occlusion.
Shall we go back to the phones?
Yes, please.
We're talking to Alex in Fayetteville, North Carolina. Alex, what's your question, please? Well, maybe Alex is not quite ready for us.
Let's move on. Sorry, Alex,
Yes.
we just missed you. Speaking of retinal occlusion, I have an interesting email from Linda. She says, I have very high lipoprotein A levels, LPA. I'm not obese. I don't have diabetes or high blood pressure. I'm 77. I've exercised my whole life doing triathlons, swimming and biking and walking. I presently swim laps and do water aerobics. Out of the blue, I had a central retinal vein occlusion. You'll have to tell us what that is. And it severely damaged my vision. The retinal specialist suggested high LPA levels could be the culprit. Could that have caused it? And I'm wondering about the baby aspirin I was prescribed. Would that be a problem?
Wonderful questions. So, central retinal vein occlusion is, if you think of the retinal vessels in the eye, you can imagine a tree. And so all the retinal branches of the vein draining back to the heart collect through the tree trunk and drain through the central retinal vein. And in some individuals, it can get occluded or blocked. And we assume that there's a blood clot there, but we don't know for sure. Now, lipoprotein A levels are known to increase the risk of heart disease and cardiovascular disease and blood clots. So high levels of lipoprotein A may indeed play a role in the development of central retinal vein occlusion. However, and that can be genetic despite all the wonderful exercise and diet that you're doing. I will say that exercise is very good for you. It's, however, very important to stay hydrated with water. We have seen cases of relative dehydration from vigorous exercise leading to central retinal vein occlusion.
Okay, I have a quick question here, Terry, from Amelia. I'm in my 60s. Is there a way to brighten the whites of my eyes? And is that a bad idea?
She does say, I think it's a vanity question. So,
Well, hi, Amelia. There are certain health conditions that can make the white of your eye yellow, and that could indicate challenges with your liver. So I do suggest if you feel like the whites of your eyes are dulling, ask your medical doctor about that and whether you should have some liver tests. But sometimes when the eyes are dry or you're tired, the eyes may get a little red. And so artificial tears can be helpful and also more sleep.
let's talk about those artificial tears because some of them have been a little controversial, and then we'll go to the phone. What's the best kind of artificial tear?
Well, so when you go to the drugstore and the pharmacy and look, there's artificial tears everywhere. And it's the paradox of choice. It's very difficult to choose. There are two kinds. There's the bottle of artificial tears, which is a preservative, has preservatives in it. And then there are the small little vials that you can open each one and use it without preservatives. So, without naming a particular brand, I would say to go with more common brands, and the pharmacist can definitely help you versus a one off, least expensive brand, which I think is where a lot of the problems have developed.
Do you have any favorites?
I do. I generally recommend Systane or Refresh tears.
And sustain is spelled?
Systane.
Joe, do we have time to talk to Sandy? I think her question is short.
Very quick.
Sandy, in Chapel Hill, can you make your question short?
Yes. Is it safe for an 85-year-old to have cataract surgery?
Thank you, Sandy.
Excellent question, Sandy. So, cataract surgery is very safe. It's an outpatient procedure and can be done with you awake in a twilight sleep. However, I would say for anyone over, I will choose 75 years old, you really have to ask yourself, do I need this surgery, whatever it happens to be? So if you're having trouble seeing to do the things that you want to do every day because of your vision related to the cataract, then cataract surgery is definitely worth exploring because it's shown that better vision can help you live longer.
We do need to take a short break, but when we come back, we'll take more of your questions about how to protect your vision. You can call us 888-472-3366. Email us radio@peoplespharmacy.com.
You're listening to The People's Pharmacy with Joe and Terry Graedon. This podcast is brought to you in part by The People's Pharmacy and our exclusive line of magnesium-rich roll-on deodorants crafted with years of expertise and community feedback. Our customers rave about their ability to control odor effectively without aluminum.
These deodorants are a superior choice for daily health and comfort. It's designed to be gentle yet highly effective, providing reliable odor control without aluminum or other harsh chemicals. Plus, they're incredibly easy to use and long-lasting.
As a special offer for our podcast listeners, enjoy an exclusive 20% discount on any size of our deodorant. Choose between the handy 2-ounce scented or unscented varieties or the economical 3.38-ounce unscented version.
Simply visit the body care section in the store at peoplespharmacy.com and enter the promo code POD20. That's POD20. That's POD20 during checkout to redeem your discount. Remember, this promo code POD20 gives you 20% off your purchase of our top-rated magnesium-rich, aluminum-free roll-on deodorants until October 2024. Welcome back to the People's Pharmacy. I'm Joe Graedon.
And I'm Terry Graedon. The People's Pharmacy is made possible in part by CocoVia dietary supplements. CocoVia Cardio Health is offered in both convenient capsule and powder formats, with each serving containing 500 milligrams of cocoflavanols to support heart health. More information at cocovia.com.
Today on the People's Pharmacy, we're talking about how to protect your precious eyesight and keep your eyes healthy. We're talking with Dr. Sharon Fekret. She is a professor of ophthalmology and neurology at Duke University School of Medicine. She's associate chief of staff at the Durham VA Healthcare System and a retina specialist at the Duke Eye Center. Dr. Fekret is director of Duke Eye Mind. That's I, lowercase I, capital M-I-N-D Research Group, and she's chief editor of the book All About Your Eyes.
And our lines are open for you at 888-472-3366. If you can't get through, we are taking email, radio@peoplespharmacy.com, and we go to Josephine, who has been very patient in Springfield, Missouri. Josephine, please go ahead.
Hi. It's good to talk with you. So in the city I live in, they've put a 5G pole at least a block away from every school, whether it's a grade school or high school. And they put one in between myself and the high school, so it's 3 houses away from my house. I can also see cell towers from my front porch. So since the 5G pole got in, I've noticed a real decline in my eyesight. So my question is it from the frequencies coming from the 5G pole in Springfield, Missouri? It's right next to my home, or something else? And the other comment I wanted to make is that I thought the study I heard about regarding the children's eyes also had to do with the amount of sunlight they got. So I'm wondering if you can clue me in on these things.
Thank you, Josephine.
Well, 2 fabulous questions. I think that it's very important for you to see your eye doctor to have a complete eye exam, because 5G poles in particular, are not thought to directly affect the eyes in any known way. So if you're noticing a decrease in vision, it's very important to have your eyes checked for a long list of potential causes. Your second question, with regard to children's eyesight and spending time in sunlight, no one's sure if it's the sunlight itself or it's just being outside and looking far away from screens and books and things that are up close that is offering the decrease in nearsightedness or myopia in children. For adults, as you know, it's very important to wear your sunglasses and protect your eyes from ultraviolet light when you go outside.
There was a fascinating study a couple of decades ago on men who worked the waters in Virginia,
Chesapeake Bay
study, and it found something about exposure to ultraviolet light and vision problems. Do you remember that study by any chance?
I do vaguely remember hearing about that. Ultraviolet light and being in the sunlight, we are meant to run around outside, right, and make vitamin D in our skin, which helps our immune system. But it is important. There's a lot of reflected light from the waters, and so it's important to protect your eyes from that ultraviolet light.
I have a question from Nancy. She wants to know about black specks or floaters. What are those little black spots that float in your visual field, and how can I get rid of them?
Floaters in general can be from a variety of things. So, a complete dilated eye exam is very important because we want to make sure that the black specks or floaters are not blood, pigment, other things that could be floating around. But commonly, as we age, our vitreous gel, which is like solid jello, liquefies over time, and it can liquefy faster with eye surgery or nearsightedness or an eye injury. And then the jelly pieces float around. During the process of that forming, if you notice flashes of light like lightning, or all of a sudden a lot of little new specks, or a dark shade coming over your vision, it's very important to be seen within 24 hours by your eye doctor. Because that could indicate that there's a retinal tear or the retina wallpaper is torn or has a little hole in it that could lead to a retinal detachment.
And if I show up at your eye center at 2 in the morning, what does a retinal specialist do when there's a retinal tear?
So at 2 in the morning, there are numbers to call to go through the emergency department since the eye center itself is closed after hours. But once a retinal tear without a retinal detachment is diagnosed, that is walled off like sandbags, so to speak, by using a laser or a freezing treatment.
And we go back to the phones. Joel in Tampa, Florida. What's your question, please?
Thank you for taking my call, and thank you, doctor. I'm 78 years old, and I have 20/30 vision in my left eye, and 20/40 vision in my right eye, diagnosed with cataracts. Cataract surgery is very common, and although that's so, I'm seeking ways to reverse cataracts. I prefer not to having a procedure, but to find a natural way to reverse cataracts. Can you please help?
Yes, Joel. At this time, there is no known way to reverse cataracts. Cataracts are cloudy lenses in the pupil of the eye that continue to progress slowly over time related to aging. And so your 20/40 eye may be ready to consider cataract removal because it's helpful to have it done while you're healthier and able to have the procedure. 99% of the time, cataract surgery goes fine.
And we go to Erie, Pennsylvania. Carmen, we welcome your question.
Hello. I got a question concerning my wife. She's 64 years old. She is not a diabetic, no underlying other health problems. And about 3 times a year, she'll get an eye infection. Antibiotics clear it up. Is something the eye doctor is missing? Is taking antibiotics 3 times a year to clear up the eye infection, could that lead to further complications?
That's a fabulous question, Carmen. So, the eye infection, I suspect, is on the surface of the eyeball and not inside the eyeball. Is she a contact lens wearer?
Pardon?
Is she a contact lens wearer?
Oh, she was previously. She hasn't worn them in about 10 years.
Got it. So periodic antibiotic eye drop use 3 times a year is not likely to cause any other problems, but as long as it does treat the condition, that's good news. You can ask her doctor if he can or she can do some special tests to figure out what the cause could be.
Good luck with that, Carmen. And let me go to an email from Rick. Rick says, I have a ceramic tile floor in my bathroom with round, pure white discs. If I relax my eyes, they start to take on pastel shades of pink, blue, and yellow. If I stretch my eyes, the color goes back to white, especially in a low light situation. What's going on?
So that's an interesting question. When we do relax our eyes, and basically relaxing the eyes to me means defocusing. And when you're not focusing and sort of zoning out, sometimes you'll see double for a minute. Your eyes are going together or going apart. But you may also see different colors, particularly if you also have some cataract developing.
Well, and speaking of cataracts, we have another question about cataracts. Ken in Medville, Pennsylvania. Welcome to the People's Pharmacy.
Hi. Hello, doctor. I'm 78 years old, type 2 diabetic for about 20 years, cirrhosis of the liver for about 10 years, and I am about 40 pounds overweight, and I have diabetic retinopathy. I've been able to get eye injections that are at longer intervals now. I'm at 16 weeks with injections of Vabysmo, and I take an Oculite, and my ophthalmologist says I'm a good candidate for cataract surgery, and I understand from talking to people who had the surgery my age that there's two types. One is a laser type, which they said costs somewhere around $5,000 or more and is not covered. And then there's another type which is much, much less. And I'm just wondering if you could tell me what those two types are and if there is any coverage available for people my age that have a low income and zero premium insurance. Thank you.
Yes. At this time, there is something called a femtosecond laser that cataract surgeons are incorporating into their cataract surgery. And although it can make certain steps of the cataract surgery a dot safer, in experienced hands, you can have cataract surgery without the femtosecond laser. So you can talk to your doctor, and if they're not willing to do the cataract surgery without the use of the femtosecond laser and don't feel comfortable doing it that way, maybe get another opinion from a different cataract doctor.
Okay, thank you for that call, Ken. We're going to...
You wanted to go to Harding, Virginia.
Yeah,
Talk
hi.
to Lisa.
Hi, Lisa. What's on your mind?
Hi, I'm calling because I want to talk about eye issues that can be hereditary, and because myself and my children have we're all nearsighted, and then I've got a history in my family of low pressure glaucoma and cataract, and then I'm nearly 70. My kids are in their 40s. When they were diagnosed with nearsightedness, they were in glasses, and then they wanted to go to contact lenses. So in order to know that they were going to be able to take care of their contact lenses, I had them each take care of a small animal, a caged animal, for a year to prove that they could take care of something and be consistent with it before I would let them get contact lenses. But I'm also kind of concerned that maybe they don't take their, now that they're in their 40s, I don't think they go to follow up on the other issues that run in our family with the low pressure glaucoma and cataract.
Thanks, Lisa.
Yeah, so I think it's important to get an annual eye exam. And then from there, if any of those conditions are noted, that particular doctor can either take care of them and follow those issues, such as cataracts or concerns for glaucoma or refer them to a specialist.
And what age would low pressure glaucoma tend to show up?
Low pressure glaucoma can really occur at any age, but it is more something in adults, and 40s and 50s is a reasonable time.
Okay.
So I want to know what to do with all my old eyeglasses because I now have a whole bunch of them. And after having cataract surgery, I don't really need to wear all those glasses anymore.
Well, out of Missouri started a startup called respectacle.org. And that is where they are reusing prescription glasses. So if you don't want your prescription glasses, there are usually drop-off points in the major cities, or you can contact respectacle.org and donate your prescription glasses, which are then cleaned up and refurbished and put on their website, and they are available for $5 a pair. Wake Forest University, the eye center there, is #1 in the country, thanks to some work from medical students there, in processing these glasses.
Fantastic. We'll put that up on our website, how you can get in touch. We have just about a minute left, Dr. Fekret, and I'm wondering if you can tell us about your crystal ball for your research. What would you like to see in the next year or 3 with regard to iMind?
In iMind, we are trying to develop an additional tool for neurologists and other physicians to use to help more accurately diagnose Alzheimer's and Parkinson's. I would like to be able to develop a machine learning AI model that can be put out there and even, who knows, an app in the phone one day to be able to know what your risk is for developing one of these conditions.
And do you hope that you'll be able to see progress over time? In other words, these new drugs that are coming out are, going to make a difference in theory with amyloid. Will you hopefully be able to track a person's progress?
That's what we'd also like to do, look at individuals before and after treatment. So you can reach out to us at imind@duke.edu.
And we have a link there on the website. That is all the time we have today. We want to thank everyone for calling and emailing your excellent questions. Sorry we couldn't get to all of them.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Lynn Siegel produced today's show. Pamela Alberta and Ayasi Chinflu provided technical assistance. Al Wadarski engineered. Dave Graedon edits our interviews. The People's Pharmacy theme music is by B.J. Liederman.
And special thanks to our guest today, Dr. Sharon Fekret. She is a retina specialist at the Duke Eye Center and vice chair of faculty affairs and professor of ophthalmology and neurology at Duke University School of Medicine. She is associate chief of staff at the Durham VA healthcare system and past interim chief of surgery there. She's currently director of the Duke iMind research group and chief editor of the book All About Your Eyes.
The People's Pharmacy is made possible in part by CocoVia dietary supplements. CocoVia Memory and Focus is a unique formula made with a special blend of ingredients that work together to promote attention and support long-term memory. It supports 5 areas of brain performance in one capsule. More information at cocovia.com.
Today's show is number 1402. You can find it online at peoplespharmacy.com. You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. That's where you can share your thoughts about this show. You can also email us your comments, radio@peoplespharmacy.com.
At peoplespharmacy.com, you could sign up for our free online newsletter so you can stay on top of the breaking health news. You also get regular access to our weekly podcast, and you can find out ahead of time which topics we'll be covering.
In Durham, North Carolina, I'm Joe Graedon.
And I'm Terry Graedon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.